Now here's a video on overweight and obesity as promised. Now although I did say that I would be making a comprehensive video on obesity, I will cover snippets of it because obviously it's a very vast subject. What I will basically emphasize on is that you need to take overweight and obesity really seriously, because it's not just as I previously have mentioned, a cosmetic problem. It is a disease in itself, and furthermore it's the kind of metabolic disorder that lies at the basis of most of the modern non-communicable diseases. So yes, let's just get straight into what obesity is, what causes it, and what you can do to prevent the worsening of overweight, obesity, and obviously the development of metabolic disorders. Yes, so what is obesity? Now, before we go any further, I will be using the term obesity to mean overweight as well as obesity. So yes, what is obesity? What do you understand by the word obesity? Almost everybody knows that the accumulation of excess fat tissue or adipose tissue, adipose tissue and fat tissue, it is one and the same, is what constitutes overweight or obesity. Now, if you look at a more scientific kind of a definition, people have suggested that in genetically predisposed individuals, those who are at a higher genetic risk, if these individuals find themselves in an obesogenic environment. Now I'll explain it in a moment what an obesogenic environment is. So if genetically predisposed individuals find themselves in an obesogenic environment and they end up in a positive caloric balance, meaning they end up eating more calories than they need for their basic metabolism and for their level of activity through the day, that combined with physical inactivity is what causes obesity. Okay, now over the years researchers have defined obesity in all sorts of different ways. There have been people who've said it's panhypopitutarism, a condition in which your pituitary gland does not function to its optimum levels. There are other people who've basically defined obesity as a disease, saying that coining in fact the term called adiposopathy, meaning a pathological state of the adipose tissue, a pathological state of the fat tissue, something that they've called the sick fat disease. Now I'll get into more details of this in a moment. So that is in a nutshell obesity. Without getting into too many details or without confusing yourselves too much, we already know that excess accumulation of fat is obesity or overweight. Now, obesity is a disease. It is a metabolic disorder. Now, people have argued that it cannot be a disorder because in some people who are overweight and obese, you cannot see any metabolic adverse effects. Fair enough, that is true. But in people who are genetically again predisposed to your fat going sick, you will see loads of metabolic and immune disorders. Okay, now I myself personally would tend to label obesity as a bigger problem, as a bigger metabolic disorder or a metabolic disorder which lies at the basis of the pathogenesis of your cardiovascular diseases, your diabetes mellitus, your hormonal imbalances, your infertility in men, women, your cancer even. Obesity forms the basis. Okay, so in those terms, I would like you people to think of obesity as a disease as well as a disorder. In fact, the biggest problem that afflicts modern humans. Okay, and this is one of the messages that I want to put across through this video, because most of us really, if you look closely, know what obesity is, but we do not realize that it is the biggest problem that affects us. And by reversing or by treating obesity, by getting leaner, you are likely to reduce your risks of all the other metabolic disorders, your heart diseases and your strokes and your diabetes mellitus and cancers even. So yes, it is definitely a disease with something that you need to be really, really wary of. It is not a cosmetic problem anymore. Used to be you know, a time when they told you that adipose tissue was just an inert tissue. It's just sat there doing nothing. But now we realize that adipose tissue or fat tissue is actually a very active hormonal tissue. Okay, one that has an influence on all the other hormonal glands as well. So the moment your adipose tissue starts going sick, your fat starts going sick, something what the researchers have called the sick fat disease, all your other hormones are also affected. Plus your immune system also goes for a toss. Now we will talk about this in the next section, okay, where I will briefly go over how obesity is going to affect you in a dual manner. Okay, it's going to affect you in an adverse way. Okay, so how does obesity as a disease affect you? Now, obesity affects you in two ways. One is your metabolic effects, and the second one is more the biomechanical effects. Okay, now I'll briefly run through the biomechanical effects. We won't be going too much into details of those. We will be obviously focusing on the more the metabolic downsides of obesity. Now, the biomechanical effects, obviously the effects of too much fat, carrying too much weight around you. Okay, now these effects are basically the stresses on your joints. Okay, so the whole joint structures, your joints, your ligaments and tendons are going to bear the brunt of having to carry too much of weight around you. And in a few weeks or months and years, you will notice the difference. So that's one. The other effects are basically because of compression of tissue, friction of tissues amongst each other, and these are basically can lead to high blood pressure, you know, sleep apnea, which is when you stop breathing briefly when you're sleeping, and obviously things like gastrointestinal reflux, you know, your acid kind of entering into the your gastric acid, your stomach acid entering back into the esophagus or into the mouth even. You know, that feeling of sourness that you get in your mouth. So these are basically because of the compression of tissues. Okay, now getting back to the metabolic effects or the downsides of obesity. Now, this happens in kind of two manners. One is it affects your hormonal balance, and number two, it affects your immune system as well. Now, if you look closely, adipose tissue, like I previously mentioned, has an effect on all the other endocrinal glands as well, right from your master hormonal gland, the pituitary, and then the adrenals, and even your gonads like testis and everything. So yeah, So the moment your fat starts going sick, something which I've previously mentioned to be the sick fat disease, all of your hormones will be affected. Now the hormones that also are affected are the hormones like leptin, cortisol and all those things. Now these are going to kind of enlarge the metabolic disorder picture. Okay, now so it makes your hormonal environment go for a toss, number one. Number two, if you look at the immune system, what obesity or overweight does is, especially once your adipose tissue becomes sick, your pro-inflammatory markers will kind of get raised in the blood, okay, and your anti-inflammatory markers will go down. Okay, so these together, the hormonal dysfunction plus the immune system dysfunction will kind of work hand in hand to make your metabolic picture more murky. Okay, and these will obviously also lead to your cardiovascular diseases and your metabolic disorders like diabetes mellitus and so forth. Now there are 4 ways in which obesity or overweight will have an adverse influence on your body. Basically the whole organ system, all the organ systems of your body. Number 1 is obviously hypertrophy of the adipose tissue. Now in simpler terms, that's just the enlargement of the fatty tissue, enlargement of each individual fat cells. So more fat is stored in each individual cells. Plus what it does is it calls into action new fat cells as well to store fat. Something called the recruitment of new adipocytes. Adipocytes meaning fat cells. Now that's number 1. Number 2, what's going to happen is you will develop something called the visceral obesity. Now I'm pretty sure you've heard of the term central obesity or abdominal obesity, where much of the fat is deposited around your abdomen. Now that is visceral obesity, fat surrounding your viscera, fat surrounding your organs in the abdominal cavity. Okay, now that's number 2. Plus, along with visceral obesity, what's going to happen is there will be ectopic deposition of fat. Okay, so you will have fat getting deposited in tissues which normally do not deposit fat. Okay, so those 2 mechanisms, one is your adipose tissue hypertrophy, second is your visceral obesity combined with ectopic deposition of fat. Now number 3, very crucial, is your free fatty acids spillover. Okay, so there will be a spillover, okay, of free fatty acids into your blood from these sites of visceral obesity and ectopic fat deposition sites. Now, so number 3 is your fatty acid spillover into the system, into the blood. And number 4, this spillover of the free fatty acids. Now, fatty acids are going to be lipotoxic, meaning they are toxic to organs. So, for instance, if they work on the pancreas, they're going to affect the pancreas in a bad manner. So they're in the development of diabetes mellitus. Likewise, if they work on your blood vessels, you are likely to get disorders of the blood vessels, for instance, atherosclerosis and all those things. So basically 4 mechanisms through which this is really, really important for you to understand, and that's why the stressing on these 4 mechanisms. You need to understand that there is a hypertrophy, enlargement of your fatty tissue. Number 2, there will be visceral obesity plus deposition of fat in ectopic tissues. Number 3, fatty acid spillover. And number 4, the fatty acid toxicity or lipotoxicity to basically all your organs. And that's how obesity is likely to produce other metabolic diseases as well. Okay. If you're an Indian living in any part of the world, whether in India or you're an Asian Indian in America, born and brought up Indian in the UK or any part of the world, basically, you've got to realize that we are at a higher risk of developing metabolic diseases because of obesity. Okay, now we previously spoke about obesity being causing problems in those genetically predisposed. We are an example. Okay, we are a very, very relevant example. Now what happens is Indians have a bigger risk of adipose tissue hypertrophy, of a deposition of fatty tissue in around the visceral obesity, and obviously we have a higher degree of lipotoxicity, meaning we will have insulin resistance, we'll have type 2 diabetes mellitus, dyslipidemia, meaning your blood lipids are not really within range, and we also are at a higher risk of the development of atherosclerotic coronary heart disease. So as Indians, you need to be extra careful that you do not become overweight or obese. This is another message that I want to put across. The previous one was obviously obesity is a disease. The second one, as an Indian, you need to be extra careful. Okay. In others, like Caucasians, they have more of a tendency of deposition of fatty tissue under the skin, rather than around the abdomen. Okay. So yeah, be extra careful if you're an Indian and if you're putting on fat over the tummy. Okay, so that's all for this video. Now I'm not going to go over the treatment options that you've got to get rid of overweight or obesity. I will try and cover that in another video. To sum up today's video, just a few take-home messages, kind of. Number one, obesity is because of excess calorie consumption and physical inactivity. Obviously there's a genetic predisposition as well. Number two, as Indians, you're at a bigger risk of developing obesity and the adverse effects of obesity. Number three is and really crucial, this is the one that I want you people to really focus on, is that obesity is a disease. It is a disease which is basically the root cause, in all likelihood, of most of the metabolic diseases that we know of, most of the metabolic disorders that affects modern humans. Okay, so do yourselves a favor, get rid of overweight, obesity, get leaner, and you're more than likely to reduce your risks of developing heart disease or diabetes mellitus and cancer even. So that's all for today. Thanks for watching. Do put in comments or suggestions if you have any, and I will speak with you soon. Also, do feel free to give a thumbs up on the video, share it around with your friends, and also to subscribe to my channel. That's all for today. Bye for now.